I'm going to emphasize aspects of the home environment and built environment that connect to health, particularly focusing on housing. Clearly as we try to decarbonize, and buildings are such an important aspect of that, we need to remember people live in homes, people work in buildings, and we need to keep the health and well-being of those populations in mind. And I think Cutler alluded to this point that the attributes of homes are not equitably distributed. The top figures from a paper we wrote a few years back looking at data from the American Housing Survey, which gave things that are frankly quite intuitive. Lower income households have smaller homes, older homes, and tend to live closer to traffic and industry sources, and tend to have attributes like being uncomfortably cold for a period of time or having cracks in the walls that can contribute to obviously energy inefficiencies as well as exposures to environmental contaminants. So you have the nexus of a number of different factors, and what that also means is that there are opportunity spaces there to increase energy efficiency and also to improve health. What the figure on the bottom left shows, this is from a continuation grant that we recently submitted for our Environmental Health Disparities Center that focuses on housing. And this really reinforces a point that Cutler was making, that energy insecure homes, those who are battling with this heat or eat phenomenon, have a number of health consequences that can lead to increased indoor air pollution. You maybe use your gas stove to provide supplemental heating, and that creates obviously exposure and health challenges. Inadequate exposures or exposures to extreme temperatures rather have health consequences, and the socioeconomic ramifications of having energy insecurity directly affect health. So in our studies, we're trying to look at the various pathways by which energy or housing insecurity can connect to children's health. Another thing just to show from a modeling paper we recently put out, which is the panel on the bottom right, is that this has enormous consequences. So we modeled for different retrofits in low-income multifamily housing, what does it do for energy costs? What does it do for population health costs through reductions in ambient air pollution? And what does it do for indoor air quality related health? And you can see the indoor air quality health is on a different scale than the other two. And so if you do a retrofit that adversely affects indoor air quality, it will wipe out all of the economic and population health benefits. The flip side is if you do it right and you retrofit in a way that improves indoor air quality, you get a triple dividend: better economics, better population health, and better occupant health, but you've got to do it right. Another aspect of work that we've done transitions from the homes to the built environment, and another aspect of thinking about decarbonization and sustainable energy is planting of trees, maintenance of green space. And so we've looked at urban heat islands in the upper left-hand corner, as many others have, and we all know that exposures to extreme heat are inequitably distributed given both heat islands and the attributes of homes. The question is, what are the health consequences? Quickly running through the three panels, on the top right we showed SIDS, or sudden infant death syndrome, associated with increases in temperature, where this is largely seen among black versus white populations, attributed in part to aspects of the built environment. We've also shown that places with more green space have, on the bottom left panel, reduced effects of air pollution on mortality. It's sort of a complicated plot, but P75, that's places with more green space, and you can see the effects of air pollution are reduced in those settings. Finally, on the bottom right, this is a plot showing birth weight and its correlation with green space, and as areas have increased amounts of green space available, you actually see increases in birth weight, and that has public health benefits across the entire life course. Thanks.